How are you doing today? My name is Doc Holliday. As you can see, I have finally had my neck surgery. See a little thing over there. So I am happy in that regard. I'm not 100% healed, but I am feeling better. But I wanted to come on here and talk about a couple of things, primarily as it relates to COVID-19. As you all know, yesterday officially we hit the 4,000 people that had passed away mark on yesterday. I think if you don't recall, I had mentioned before that we're going to start having 4, 5, or 6,000 people perish a day, and now that time is upon us. Now, would it be every day that we have 4 or 5,000? No, but it will start to be more and more days out of the week. Maybe it's once or twice this week. Maybe it's once or twice next week. Maybe following week is 3 times or whatever. The following week maybe 4 times. You know, it'll be keep on growing, or the number of days that are going to be of 400,000 or more are going to be growing. The number of days per week, that is 4,000 or more, is going to be growing as time goes on. Let's see here, one quick second. I want to go to, give me 1 second. I want to go ahead and show you what was that? I want to show you this here. As you can see, there's various, like for example, this right here. I'm on Google mask and just brought up COVID mask on wrong. And I just wanted to show you a couple of different photos of people that are wearing a mask wrong and people that are not wearing it wrong. I mean, not wearing it right. I said that wrong. People that are wearing it wrong, and also people that are wearing it right. For example, this gentleman right here, he in the top 2 portions is wearing it wrong. This one here, he's wearing it up under his nose, and this one here, he's wearing a beard diaper. It's not covering his mouth or nose. Remember, people, that you breathe, inhale and exhale out of your nose. You don't inhale and exhale out of your mouth. So, and it isn't just the big particles like spit and everything that can make you sick. It is the aerosol particles that can make you sick, which means that the aerosol particles can go up your nose. It isn't just that you're trying to make sure don't nobody rain down on you as they're talking, rain down spit or saliva on you as they're talking. You're wearing this for more than just that. You're wearing it because of the aerosol effects on it. So as you see here in the lower right hand corner, this is a thumbs up. This is the correct way of wearing a mask. And even I would actually say, I would go one further and say that I don't believe that he has the top part pinched good enough. So he's going to have some airflow go in and out on the sides here. Then take a look at this young lady right here. She has on one of the masks as well, and with hers, hers is worn very well up top. You can tell it's pinched up real good, but the problem that she has is that this mask is too large for her, because you can see through the sides there's a big gap where and when she inhales and exhales, a lot of the air is going to be coming in and out of the side here, because air flows through the pathway of least resistance. So that's why a lot of the air is going to be sucked in through the sides and exhaled through the sides. So if she's in a room with a person that is shedding a lot of virus, this mask is going to offer her minimum protection. Speaking of which, I should mention as well that in fact this is the wrong type of mask to wear, because it doesn't look like they have a filter inside of this mask. With this mask here and with this mask here, they're not the best because of the materials of which they're made out of. 9 times out of 10, if you see a person walking around with a mask like this, it's not a medical grade mask, meaning it's not an N95 mask. So the virus will be able to fit through there. It may be harder to fit through there than if you would have no mask at all, but it is still able to go through the mask, through the pores of the mask. That's why you want to have an N95 mask, because it says that it's able to block out everything up to the 95th whatever element or whatever that you want to call it. So another thing is one look at, they illustrated down here as well how to wear a face mask correctly. They have the nose and the yeses on the side here. Again, the one with the chin bib, and then one right up under the nose. You got one where, let's see, this one here is, I guess this one is wearing it too low on the mouth. It also has a bunch of binding on the here, let's try to click through here. It has the it's lower on the nose, so you don't have a form fit on the nose. It also has the gap right here on the sides, and also it's not up under the chin. So that is the problem with this. And as you see here, this one does not have a gap on the side. This is much smoother. It is a more fitted mask for her, as opposed to just something like this where you have the air able to get in on the side. This is actually the first illustration that I've actually ever seen that kind of proved my point. Ha ha ha. That's good to have. I'm gonna have to remember that. So yeah, give me 1 second here. Let's do it that way for now. So I'm hoping that is that really rings a bell, that everybody is able to see, to understand that. Here's another one, mask worn the right way. Again, they're worn high up on the bridge of the nose, then they're actually pinching down the sides of the mask to make sure that no air is able to seep through through the sides where you're between like your nose and like your cheek and everything. If you don't squeeze that that metal part down, you're going to have air seep through the sides, which is, you know, what they're illustrating right here, because this part right here is actually, you know, a ½ inch or from her face, whereas this one is actually right on her face. This is the way that you want to have the the mask fit. And as well, you see that this has a big air on the sides, illustrating that this is probably too big of a mask for her. You want to make sure you don't have that and have everything fitted more on the sides. And the same thing with this young lady right here. Plus, she doesn't have it over her nose at all. And this lady is still lacking as well. She doesn't have it over her nose at all as well. So I wanted to give you that bit of advice. Please make sure that you and your kids, or your brothers and sisters, your mama and your dad, make sure everyone in your family and your friends and your community is wearing a mask correctly, you do have the right to tell them, hey, excuse me, sir, do you know that your mask is being worn incorrectly? And you can let them know the correct way of doing it. It's part of helping thy neighbor. You do want to help thy neighbor in this regard, definitely, because if you don't, your neighbor could come down with the disease, and you don't want that because you could fall victim as well to that. So let me see here. Let me go to. Let's see here. I'll go to the COVID dashboard here. All right. Today we got thus far 53,000 people. Yesterday we had 279,000 people that have reported as catching disease, and over 4,000 deaths yesterday as well. California, it had a total of almost 40,000 people came down with it yesterday. Texas coming in second with 22,000, or almost 23,000. Florida almost 20,000. New York 18,000. And North Carolina 10,000, and Ohio 10,000. Then close behind that is Arizona, Pennsylvania, and Georgia close to 10,000 themselves, and Tennessee coming in at 9,000 even. So those are the top 10 states, and that is not good company to be in, because these are numbers that are going to be growing, unfortunately. Again, I want people to understand it isn't just that people are not wearing masks. It is that a lot of people are wearing masks incorrectly, and or they are not disposing of the mask correctly as well. Because in all of these cases, these masks that these people are wearing are all disposable masks. They're meant to be disposable masks, meaning that once you finish wearing them, you are to put those masks into a receptacle or a wastebasket, and they are to be thrown away. They are not to be used repeatedly, day after day, yet alone, patient after patient. Between each patient, one should change out all of their mask and everything, mask and protection, because you don't want to have any of the virus leach onto you, and then you be the person that carries it from A to B to C to D. You don't want that to be like that. I think there was a situation where it happened in a hospital. There was this person that was being some sort of a mascot of some kind, and he ended up spreading coronavirus to like 40 people throughout the hospital, because everybody wanted to give it a hug or something like that. And because of all those hugs, the coronavirus was pasted on this person's on the mascot, and as each one of the people came by, they inhaled it, and that's how they caught the disease. Or I shouldn't say pasted on, but anytime that they're shedding of it, the virus sticks to the surfaces, and it doesn't mean that anybody explicitly set out to put it on there. It's just there because someone was affected. So you definitely don't want to be playing that same role and being a person that spreads it to everyone, to all your patients and everything. So you definitely want to go ahead and dispose of it, because too, when you go back to the how do you call it, the desk or whatever, you're not going to have those same protection devices and everything on. So The same thing when you go into another room, you want to make sure you have new protective equipment on. So we have that little fiasco. That's news that I guess everybody should have come to expect from me right now, as of right now. But there's more. Unfortunately, we are already at a disastrous state right now. We are already we're going to reach, like I said, 1 million people that will die from coronavirus. We're going to reach that by what do you call it? We're going to reach that by July the 4th. So just want to remind people of that, because a lot of people may not really realize it. Why can't I do what I want to do? So okay, so bring this back up. I'm having some mouse issues, so please excuse me as this thing goes crazy for me. So I am again calling on all all states, cities, counties, all governments, agencies to look at the freaking numbers and understand that these numbers are not going to get any better anytime soon. Largely because we are giving the, the immunization to the wrong people. So it's just not going to, being that we don't have the vaccines given to the right people, it's going to take a lot longer time for our numbers to start diminishing. Largely because even as or in addition to the fact that we're giving it to the wrong people, they're going slow as heck about doing it as well. So that just complicates the matters even more so. For example, right now, there are 21 million vaccines distributed according to the CDC right now. And it's actually only almost 6 million that have been received by patients. So what's that? 5,900,000 that have received the first dose. And, we need 10 times that before we actually are able to get to any other regular public to receiving their first dose. So we're going extremely slow. It was again promised by Trump that we would get 20 million vaccines that were not only distributed, but also 20 million people vaccinated, or at least receiving their first vaccine by the end of last year. And here it is, the 8th of the following year, and we are still only at 5,919,000 people having received the first batch of the vaccine. So, in addition to that, we have situations, or part of that reason is because we have situations in the long-term care facilities where they have received almost 4 million of the 21 million distributed, and they have only vaccinated 603,000 people since they received the vaccine. And that's been like a month now. Shucks, come on, bro. That they have received the vaccine. So in here you can check covid.cdc.gov, and they actually have a readout of how many vaccines were actually distributed and how many have been administered and things of that nature. I guess the Texas has administered the most with 545,000 people that have received the first dose. they have in total received from the government 1,676,000 and 925. Now California has actually received what was that 700 or 7,000 70,000 more of almost 70,000 more vaccines, yet they have distributed 17,000 less than the state of Texas. So there has been some slowdown. Largely, it's probably because of the lack of staffing that they have available, though. That's just part of the piss poor planning of the federal government, God, and all the people involved. I really hope that they do not keep on Dr. Fauci, because he represents part of the problem, in my opinion. I mean, what is he? Is he just a spokesperson? Like, he doesn't have no charge of making sure that things are done right. Like, things have not been done right since the inception of this virus, and I don't think that he'll be a good person to continue on in his seat. I understand that it was largely ridiculed by the president, but still, you gotta. No, I would not have Dr. Fauci working for me. It's a wrong move, and I hope that that more people agree with that, and they will contact the administration, Biden and others, and tell them that they need to not hire Dr. Fauci. He does not need to be the face of the rest of this COVID pandemic as far as curing itself. Largely because he holds no credibility. And two, he hasn't done enough to of making the proper suggestions that would enable us to beat this thing. Number one, in terms of the mask, he knows dang on well and good that we're not wearing the proper mask that we should be wearing, and two, that we're not wearing them right. He needs to be more on his bullhorn, saying that, hey, you need to be doing X, Y, Z. Instead of not being on his bullhorn. I don't know. Seems like he's doing more of defending himself or defending the administration, or doing other things, as opposed to creating proper policy to make sure that we are we try to avoid the calamity that we are actually finding ourselves in right now. But that being said, I want to move along. California currently, right now, it has more coronavirus cases than actually it has ever had throughout the whole time with coronavirus. Right now, California has 1,460,000 active cases right now, and all of last year, they had 1,088,423. So right now, currently, we have over 400,000, or close to 400,000 more active cases in California than we had all in total of last year. So that just goes to illustrate to you how much of a burden is on the California healthcare system in trying to treat the patients there, and the majority of those patients are coming from the Los Angeles or Southern California area as well. I think the highest it goes up is Kern County, but San Diego County or San Bernardino County, San Diego County, Los Angeles County, and I think it's San Fernando County is the other one that is actually, still producing the highest numbers as far as patients that need to be medically treated or have caught the COVID-19. And then Second on that list is New York. New York currently has more cases than it has and has had ever um, in all of 2020. Right now, it has 590,000 cases currently, right now. And in all of last year, in total, it was 487,698. So, you know, we also have Arizona. It has almost 5 times more cases active right now than the total cases that it had all of last year. So, it's just amazing at the numbers. Maryland, I mean, has, what is this, 13 times more? Jeez. Now, granted, these were these some of these were probably picked up around the end of December or whatever. So I guess you can say the 11 months prior to this, these were the numbers that they had. Whereas right now, we currently have these numbers that are currently active, which means that we are in dire straits. Of course, you see that every day we're adding 280,000 people to the rolls that are infected, which means that there's a lot of virus out there, which means that there are a lot of people that are either not wearing a mask or not wearing a mask correctly or not wearing masks that are a high enough level of protection per your environment. Because me personally, I don't wear this type of mask. She's wearing it wrong, but I don't wear this type of mask. It's cloth mask. You need an N95 filter to be able to filter out everything that you use. Everybody is wearing masks like these. Everybody is wearing a mask like this young lady right here. Let me show you real quick. Why can't I get this stuff to do what I wanted to do? I really have to switch out my all right, so like this lady right here, this neck thing, this thing is no good. No one should wear this thing right here or masks such as this, because they do you no good at all. You have to have a mask that's like N95 or better. So you should, like something like this would be a lot better because it has the N95 filters on it. A lot of you can make the mask with N95, but if you cannot, this is a good design. I would pinch those in a little bit firmer for the kids and everything. But these type of masks would be at a minimum, because a lot of you know that I actually wear a respirator, so I had to go above and beyond because I'm not going to be catching this stuff at all. So I would urge you all to also upgrade your mask to at a minimum a mask like this here, where it actually does cover everything and prevents any kind of air leakage or anything out the sides of the mask. So, and also I would make sure that your mask is fitted to your body type, because a lot of the masks, the blue masks, are at a larger or fit a larger frame. They're like one size fit all supposedly, but if you're a smaller frame person, they don't fit for you at all. So definitely keep that in mind as you're getting your mask and everything. Let me see, what else did I want to show? We have like 14 different states that currently have more people sick than they have ever had in all of last year. Let's see. We need to be doing a lot more testing as well. Right now, I believe we're doing somewhere around 3 million. No, not even. We're doing like 1.5 million tests a day for COVID Let me see here. I think it was 1.5. So all the tests that we have. Got an 8.87% positivity rate nationwide. I'm trying to think, where is... I thought it was, I don't know. I don't know. I guess I can't find what I was looking for. Let me move on to something else. This is a time for hypervigilance to make sure that you are not catching anything. Try to avoid all public transportations. That includes buses to and from work or to and from school or what have you. You better go buy you a bike and bike it to school or work. Trains, planes, and automobiles, if it's packed in there, do not pass go. Do not collect your $200. Do not proceed on to that trip, because if you do, you're putting yourself at risk. And that includes going to like amusement parks. That definitely includes going shopping, because you can catch coronavirus while you're shopping, especially if you're walking right behind somebody that has that virus and they're talking and stuff, because all you're doing is walking right into the space that they occupied 2 seconds ago, and walking right into the cloud of disease. That's just like if somebody had passed gas in front of you. When they pass gas, that air is you're going to walk right through that stale air after they pass gas. You'd be like, oh God, what was that smell? It was them that passed gas. The same thing happens when they are shedding. If they emanate a lot of the viral load out into the air because they're breathing and everything, you're going to walk right into that cloud of air and that viral load, and you're going to inhale it right in. But this time it's tasteless, it's smellless. You're not aware of it, but being that you are there and you're walking right behind this person, that you're going to inhale it. And the aerosol stuff does not just fall straight to the ground. It remains in the air for a while, regardless if you're outside or inside. It remains in the air for a while. It dies quicker outside, but it still is out there. So keep that in mind as well. So if you're packed real close out on the outside in lines for voting, or some other reason, you want to keep your distance as well. That 6 or 8 feet, or I'll be more like 8 feet away from a person. Now, again, as far as the testing, also remember that a lot of these test results that are, of people receiving multiple tests, being that they are in maybe school or K through 12 or college, or their work, or if they participate in any kind of sports, the NFL, the WNBA, the NBA. If you participate in any of those organizations, they are going to do multiple tests per week, yet alone a month. So realize that the numbers are kind of screwed as well when looking at them, because of the fact that they also include individuals that receive multiple tests per week or per month. So it isn't as though these are 22 million individuals that have actually taken the test. It's actually probably more like 15 million individuals that have actually taken a test. and that other 7 million is, the result of people having to take multiple tests for multiple weeks for work or school or otherwise. So keep that in mind. I think right now we're actually doing 1.5 million a day, and we need to actually be at 5 million cases or tests a day to try to get ahead of the virus and slow the transmission down. Being that we have the new virus that has spread it already, currently that new virus is 52 cases that have been detected in the U.S. 22 in Florida, 1 in Georgia, 1 in New York, 2 in Colorado, and 26 of them in Canada. In California. So these are a lot of cases. 52 by January the 8th. And remember, they haven't locked anything down. They're doing tests now. It took a while for the test to be done, but the test is not going to give you, the test is a false sense of security. Just because you're testing people as they come in doesn't mean that they do not actually have the test or actually have the virus. So those people should be actually self-isolating, barricading themselves, whatever you call it, because of the fact that they could come down with the disease later on through their studies or during their travels. So quarantine, that's what the word I'm trying to use. If they come in from another country or whatever, they have to quarantine. But the U.S. is not doing it, and that is the reason why it's going to be a lot more than 52 people having it, having this new variant. A month from now or a year from now, that is going to be the primary, variant that is going to be around the U.S. Just like it's doing in the UK. I think right now the new variant is counting up to it's 70% more contagious, and it also is representing the majority of the new cases that they're having right now over in the UK. And they are spiking. So with us here in the U.S., we are already at capacity, beyond capacity. We're actually overflowing with people that are in need of health care as it relates to COVID. We don't need to be adding another virus on top of this one that is actually 70% more contagious. That we are behaving very irresponsibly by not shutting down. We need to shut down everything in order to prevent more people from contracting this disease. We are going to have 1 million people to have died from this disease by Independence Day. The 4th of July, we're going to have 1 million people, approximately 1 million people that would have died from coronavirus. And because of our continued inaction, we're going to, by the end of the year, we could be because of this new variant, we could be to as much as 4 million people that die because the government isn't doing nothing. The government isn't doing nothing to make sure that those people that come in from overseas are quarantining. I think the only person that I've known that actually has been requiring people that come from overseas to quarantine is New York. I think he's the only person that has, the only governor that has actually implemented that. But as far as on a national level, that should be done as well. On a local, state level, for every state, for every city or township or county, you should be implementing the same thing. If you have a traveler that is coming in from Europe or the UK, they need to quarantine. Additionally, I mean, you all have to. We had to shut down. We had to shut down. That's really all that can be said. I know a lot of people are considering going back to school. Please don't consider it, because that is a petri dish. Just like your cruise ships and everything are petri dishes, the schools are petri dishes as well. Most of them do not have adequate enough. There is no adequate enough ventilation unless you have reverse airflow rooms. And 9 times out of 10, the kids' rooms are not that way. They just maybe have some windows open and a fan in there. That's not going to do enough to stop the coronavirus. The kids need to be out of school. I understand that it's detrimental to their development and blah 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 blah, but so is dying. We need to make sure the kids are safe and they need to be held home from school, and because that is the reason. The school is the reason why we're at this point right now with almost 300,000 people being, well, aside from the holidays, but we're already at 200,000 prior to the holidays. So, and the reason why is because largely people went back to school, largely people went back to work, those who could go back to work, or could find work. So we need to shut it down, shut it down, shut it down. So I guess that is it for today. I just wanted, to share those few things. I'm hoping that the people in higher education, in the colleges and everything, will also not allow their kids to return. I'm hoping that they will also switch to all online classes, and try to make it work that way. It's very unfortunate that we have to do this, especially to those that are poor. I hope that the governments can provide more funding for those that are poor in order for them to receive internet services to help the child to keep up, because that helping that child to get internet services, I mean, what is that, $1,000 a year? That's nothing compared to the $12,000 a year that we're going to be spending with by keeping this kid behind in school. So if it's $1,000 a year per pupil, whatever the case may be, hey, we gotta suck it up, and make sure that we get the internet. But a better solution would just be to have free internet brought to you by the different municipalities. If you all could get on that, put up some couple of towers, free internet for your community, especially those that are poor, those kids will be able to hop on the internet and take care of their collegiate or scholastic duties. Let's see. I guess that is it for now. I know this has been long. I apologize as usual. Anything else I want to say? No, I think that is all. What I will do is I want to show you guys this. So this is the thing. It's still got like a little scab or whatever, but they had to cut right here. They had to pull out my throat and everything. Then they had to come in and pull out each of my vertebrae, and then they had to put new vertebrae in there and fuse a lot of stuff in my neck and everything. It's rough. It's rough, but this was again because of the accidents that I had. One in California and one in Florida. So hopefully I would make a full recovery and be able to be back to my normal stuff pre-accidents, and that would be awesome. But thank you all for tuning in. Please do like, share, subscribe, and make sure that you all upgrade your mask. And for those of us that are considering possibly doing some protesting, as Lord knows, we're not finished doing protesting. If you plan on doing some protesting, buying a respirator would be able to serve double duty for you. It would not only be able to you would not only be able to use it to prevent COVID-19, but you can also use it to prevent any kind of gases or whatever that they use from the police to try to quell the protesters or whatever. You could use the respirators for that as well. So I would definitely recommend making that purchase. It's a very wise investment. But thank you all again for taking your time out to view this. I very much appreciate it. Please, if you have any questions or concerns, please do leave them behind. I will say that no, I'm not going to leave. I'm not going to divulge that right now. But yeah, everyone, have a good day. Talk to you later. See you later. Okay, bye bye.